Hey friends, welcome back to the Rocky Road podcast. We wanted to drop a little note that we have decided to make this episode with Allyson a two-parter. It is a lot of information, a really amazing conversation, and we just didn't see a reason to stop it once we got to kind of our time limit. So please enjoy part 1 of our episode with Allyson.
Hi everybody, welcome back to the Rocky Road podcast. As we always say, I'm Mandy.
I'm Kristen.
And we are here with our guest. Her name is Allyson. You can introduce yourself, Allyson. She's a friend of mine coming to talk to us today. And yeah, introduce yourself. Tell us who you are. Briefly.
That was not in the questions you gave me.
I'm sorry. Spur of the moment.
So I'm Allyson. I am a mom. I have 2 boys, 6 and 3. Mandy and I actually met in Jamaica way back in the day, doing some music therapy stuff. So I actually have a degree in music therapy. So I'm a whole host of things. I'm a homeschool mom. I am a music therapist. I teach piano lessons. I do blogging.
Yep.
I garden.
A little bit of everything.
I don't know. I do a little bit of everything. So
Fun fact, Allyson and I did not meet in the United States until last year because we only met in Jamaica.
Mm-hmm.
I didn't realize that you had met in Jamaica, first of all. Mm-hmm. So I know that I thought that there was another music therapy connection that was in the States.
It was a music therapy trip to Jamaica, but we met when we got there. So we didn't actually meet in the US.
That's kind of cool.
Yeah. And then we just kind of connected over social media because you had Reagan not long after.
You had Theo.
Yeah. So
it's cool. And then we just stayed connected. It was kind of a weird thing. We hadn't seen each other in 10 years. And then we went and saw each other. Well, I went to her, saw her. So
yeah,
it was interesting. But yeah, so you came today. We asked you to come to talk about home birth and just birth in general. And I guess just your experiences with it. So we gave you some questions. You're uber prepared.
There may or may not be an outline in front of her.
We're here for it. Actually, you lead us today because we don't really know what we're doing.
And this is going to be interesting too, because I have not ever given birth or been pregnant, and both of you have.
Correct.
And everybody here has had a different experience with pregnancy, me being none, you each having a different unique experience. So that's going to be really interesting. And I'm sorry if I ask any asinine questions, because I truly don't know anything about birth yet.
But I think
no judgment.
I think that's good. And that's what Mandy and I were talking about. I think it's, I have a vast array of experience when it comes to like pregnancy and birth and all the things with that. And then Mandy as well. And then your experience as well. So I think I think that's good though, because the people listening might have those questions because they also haven't experienced certain things, because everybody has a different experience.
Yeah. So, Allyson has 3 birth experiences. I have 1, you have none, but there'll be people listening that are either guys or maybe somebody who has never had a child, never wants a child, has 5 children. We don't know who's going to actually listen, and it'll be really interesting. So,
I think from the guy's perspective too, like, my husband, when I first introduced the idea of like, home birth, he was very skeptical. And then we met with a midwife, and she is sharing all the statistics and the facts and the science. And he was like, okay, I'm totally on board, because I think just, it's good for the men too, knowing, like, having that insight and
how to support your wife, your significant other.
Yeah.
That's true. And I know we talked about this before, and we'll just kind of flat out just say it while we're here, is everybody has different opinions. And this is a very hot topic, I think, in the mother world. One of the things is for you is just you're sharing your story and you're sharing what you've learned and what you decided. People will make what decision works best for them. And I think the biggest thing that we had talked about too when we were preparing for this was just knowing that you have options. I do also, like, just full disclosure, after having a kid, you kind of slightly get obsessed with it in like a way of like, it's just so interesting that you're like, wow, what just happened? And so it's something that it's good to just educate people on, but I secretly just love it, and like watching birth videos and birth stories and just the cinematography aspect of it can be so beautiful and it's so great. So I personally just think it's awesome that you're sharing about it. And I think a lot of people have very traumatic experiences, I would say. And so having good, positive experiences, and some hard and grief involved experiences, and you have all of that.
Yeah.
So, walk us through that. Tell us what's going on.
Yeah. So where to start? I think what you said about knowing your options is a big, big piece of pregnancy and motherhood that sometimes can be overwhelming because you have all these options flying at you and deciphering what is best for you and your family. And, for one person, maybe that has more high risk medical complications, a certain option would not be the best option versus someone else who's maybe more low risk. Might be totally different options, but also just knowing your options and knowing what questions to ask, I think is a big part that women just don't know what to ask. They just kind of go in blindly, I think, into pregnancy or into motherhood. And from the minute you get pregnant, you're literally learning new things and new skills and how to take care of your body and then how to take care of a newborn. And there's so much stuff flying at you. And so I think probably the biggest thing would be before I hop into the whole running through stuff is the light bulb moment for me probably in the last year or two was just that we are constantly learning new skills, and nobody outright says that to you. You go through classes and all of that for pregnancy and labor and a little bit for postpartum, depending on the class you take. But nobody talks about you are constantly, daily learning new skills, sifting through information. And it is, when you go to college or a new job, that takes time, and you're learning, you're learning those things at college or a new job. And it takes time to learn those things, and you have to adjust. You might do some things wrong. You might do some things right. It's just in motherhood, I think we tend to be really hard on ourselves as we're learning those new skills and working through all the different opinions coming at us and things like that. Cause everyone does motherhood differently. So
they do. And kids are constantly changing, especially early on. So.
Right. Which is why I think it's important to be you are learning new skills every day because kids are constantly growing. It doesn't stop. It's not just a flat thing. It's,
how to give birth is different than how to take care of a 1-month-old. That is different than how to take care of a 6-month-old and a 1-year-old and a 3-year-old and a 5-year-old and an 8-year-old.
I don't think we do not prepare women for that postpartum, I think, experience. You might hear the well, just wait, you're gonna be super tired, and it's why do we say that to women? Yeah, okay, you're gonna be tired, but you're also going to have this all bundle of joy, and you're going to be able to help raise a child and things, and all that. So.
The beauty that's in it.
Right.
If you have, jobs are hard work, like you said, compared to all the other parts of your life that are difficult. And also with motherhood, it's 24 hours. You don't get to leave at 5 p.m. and go home for the night. Right. It's you're with your kid the whole time. And yes, it's exhausting. And yes, there's a lot of work. But I think too, and we can talk about motherhood in a whole other episode, but just that being a mom and then having all the judgments of other moms and what do you decide and what's best and how are you parenting and you should have made your child do this and you should have done this differently. And even just going to the playground or, what does your kid watch and how much screen time do they have and how much playtime do they have? And are you homeschooling? Are you private school? Is it a public school? It's all these judgments that people have and moms have. Can be really hard. So like you said, it's just options and just having the grace and the understanding that people choose differently, and that's okay.
Yeah. I actually had literally something like that in my notes. So I was looking to see to make sure. Yeah. As a mother, you're learning all these new skills. You're deciphering through the information to determine what's best for your family. Because you have things like gentle parenting versus spanking. You have people saying, you should do this medically for your child. Do you co-sleep? Do you not co-sleep? Do you homeschool? Do you send them to public school? And I think it's you grow so much through the process because you are having to really stand your ground on what is best for your family, and sometimes tuning out the noise of social media mothers or people that are close to you. Or I think family is hard, especially if you decide to do something different than the way you were raised.
And also generationally within a family.
Yep.
From the way our parents parented to the way we parent to the way our kids will parent is very different.
It's a different world.
Totally
it's a
different
totally
world.
different world. And so, yeah, I think those are really hard things, but also just can be really good things because you are the gatekeeper. You are the person that gets to decide what is best for your family. You are the one that gets to ask God for help through that process and what is best for your family.
And the key word being your family, because what your family looks like being married with 2 kids, and then what my family looks like as a single mom with my kid, and what Kristen's family will look like being married with 1 kid and a big dog. It's like, it's going to look so different. I had said this to you before. I wish that I could do different things, but I can't because I have to work. I have to put her in school. And people are limited even with so many things as far as finances. So like they can't afford a private school. Maybe they want to, but they can't.
Yep.
So the best option for their family is a public school. And then when you meet with somebody that puts their kids in private school, don't judge them. You don't know what's going on that made you decide to make that decision.
Yep.
So,
yeah, I mean, I know someone who they do private school, and her husband works full time and then does DoorDash a couple nights a week to help pay for private school because they just decided that was based on where they live, that was the best decision for their family. I have a friend who they're doing, they're going to do public school to see how it goes. So, I mean, once again, it's just everybody's experience and more experience, I think, and is different in what is best for their family. So,
well, experience and priorities too. Like there are some people who do not care or maybe just don't have an awareness of the importance of the different types of education for their kids and say it's all public school, it's all this, they're all getting the same information. Or some people who, like, I do know there are some people who have done like cyber school or homeschool specifically because they're so fearful of what public schools, private schools, no matter what, will offer their kids. And so it's just, it's all different priorities and awarenesses.
I think there's almost three things here. You have priorities, which I think, once again, figuring out your priorities for your family. You have your experience that we all come into the situations with. And then you have priorities, experience. I lost the third one. Hold on. Priorities.
Education.
There it is.
Awareness.
Okay. Education. I think that, so you have priorities, you have experience, and you have education. Because you don't know what you don't know, right? So I think some of it is just, once again, that kind of ties almost into the experience of you learn things over time or you gain education that helps you to better determine the decisions, prioritize. So they all kind of tie together, the priorities, the experience, and the education.
But it doesn't make one right and one wrong.
Correct.
They're just different.
Correct.
Yes. So walk us through your experience then and talk about what led you to your decisions and that will involve all of it, experience, education of you learning from things and then awareness.
Yeah. I mean, I could talk about a whole host of things, but I know we had kind of talked about just focusing more on the like home birth and then tying other things in. So,
can I start with a question to kind of like gear us? So
go for it.
You said that a lot of women, and probably, new moms, new dads, all of that, going blind. What questions did you ask on the first go around or didn't you ask on the first go around that then having a child helped you to learn to ask on the second time? That's
perfect. So I think in terms of when you are pregnant or planning to get pregnant, knowing what questions to ask providers in determining providers, because there are providers where you'll ask them certain questions and it'll be red flags. Like, you need to find someone else. Or maybe you're in that practice and you switch. Because I know I've heard moms do that where they're like, it's 30 weeks, and they start seeing red flags and they're like, this is not going to go well, because this is the person that you're entrusting to help you through labor and delivery. So questions typically you can ask would be things like, what is their cesarean rate? In particular, because if you have a provider that their cesarean rate is really high, it makes you go, okay, why is it so high? Is it because you have high risk patients, or is it because it's someone who's quick to just jump to the cesarean and not let your body do what it needs to do? So asking questions like, what is your cesarean rate?
And by that, just to clarify, because the first, when you said rate, I was thinking cost, but to clarify, that's the rate ratio, basically, cesarean versus other.
Yep. The like percentage of, so typically they have like a year. Most doctors will have like, here's our number of births we've had this year, and here's the percentage that were a cesarean or, had episiotomies or types of interventions. They will have like percentages. So they can say like, 30% or something like that. Because there's some practices where they'll say, oh yeah, we have like 60%. Wow. That's really high. And that would be a red flag to me. And someone who is probably not going to, if you're wanting a natural birth, is not going to support a natural birth. They're going to be quick to push interventions or push you towards a cesarean. Other questions you could ask would be, how do you approach natural birth? What are their rates of intervention for natural birth in terms of, like, once again, percentages? What types of monitoring do they allow? Other questions you could consider would be, do I want a hospital birth? Do I want a birth center birth? Do I want a home birth? And also too, at least where I live, the different hospitals in the area, like I'll see moms ask, some are more natural friendly than others in terms of like the nurses that are going to be working with you too. And because they're also a big part of that, obviously, if you are doing a hospital birth. So those would probably be some of the questions you could ask. You can also just Google like what questions to ask your provider. Those are the big ones though. Just, I think finding out like rates of intervention, I think is a big one, because that's going to determine the kind of care you're going to get.
I think one of the first things that you said was really important was knowing when choosing providers, when there are so many people who don't know that they can choose the providers for anything. I flat out tell clients who are, aware and who can have this conversation. I said, if something is not working out and if this isn't a good match, please don't feel awkward. I might not be the best therapist for you. And the same thing that a lot of doctors won't say that, but it's important that it's a good match in so many ways. And then of course, geography, finances, there's going to be some limitations. You might not have a lot of different pregnancy centers in a certain geographical area. That might be a limiting factor. But
there's also state laws too. So you have to be mindful. States have different laws. So you have to just research it and be aware.
Correct.
And know also, I think too, even before you ask, is knowing what the interventions are and what they can cause. Because any type of intervention in any scenario, works, anything has a consequence or a side effect or something like that to it. So it's like, okay, well, why am I asking about interventions when they're all fine? It's all like, this option. It's like, well, some of them can cause long-term issues or birth is very personal. It's very invasive. It's the most intimate thing a woman can do with her body. And so knowing that and being able to make those decisions based off of your body is really important.
And I think, so with birth, at least in American culture, we tend to think of it as a medical event. And so yes, interventions like our life, so my sister was a preemie. She was born 3 months early. So for her, the NICU and all of the things that happened were life-saving medical interventions.
Absolutely.
So I think there's, once again, a time and a place. Everybody's medical history is different and their health is different. For her, it was life-saving, but because I think we think of birth as like a medical event versus just we're giving birth. Like it's what our God created our bodies to do. And we don't trust our bodies to do what they need to do. Like we're not in tune with what our bodies are doing. because we're thinking through like the interventions but I think, sorry, I'm getting off track here. The education piece of what you just said is important, because with my first, we went through this more in-depth class. It was a hypnobirthing class, but there was a lot of education on, this is what an episiotomy is. These are some complications you can have. This is what, making sure your provider is asking for consent to do those things. This is what a vacuum is. This is what forceps is. This is the complications of Pitocin. If you choose to do Pitocin, like, these are some of the things that can happen. This is, this is an epidural. These are, the pros, these are the cons. Like, knowing those things going in is super helpful, because when you have that knowledge, it's going to help you to make a better decision in the moment, versus just not knowing those things and not knowing how to ask those questions, and being able to advocate for yourself.
And being asked those questions while you're in labor and trying to make a decision while your body's in labor is not good either. So you you got pregnant, you had your normal provider that you had at the time.
Yeah.
And then what happened at 35 weeks? They realized he was breech, which just means that he was feet first.
He was butt first. Yeah. It could be feet first. It could be butt first. He was butt first.
So folded.
Yep. Yep. He was like sideways. His head was like up in my ribs.
Comfy.
Yeah. I thought it was his feet kicking me. No, it was his head. Which made a lot more sense when I found out. But so chiropractic care, I think if I had a good, like, it's called Webster certified for pregnancy, and it basically they do a lot of things to basically help get the baby head down, getting things in alignment, helping your hips to open, things like that. So that was one thing I wish I would have known more about and just didn't know. And I would highly recommend for anybody that's pregnant doing regular Webster certified chiropractic care. So he was breech. I ended up actually going to 41 weeks because they basically let me go to 41 weeks. And I was just like hoping he would flip. I was doing all the things to try and get him to flip head down. He did not flip head down. So I ended up with a cesarean just because that's what they did. They wouldn't let you do a breech birth where I was at with the provider I was at. Because I had a cesarean, I had a very rough recovery. I didn't get out of bed for probably close to a month just due to you have major surgery. I think people, when they think cesarean, they're like, oh, the baby's here.
It's easy.
It's easy, right? And some people do have easy recoveries. I did not. I had a lot of abdominal issues. I struggled to even sit up with assistance. I had a lot of pain. So I had a whole host of, on top of having a traumatic cesarean, which is not what I wanted. I had a really rough recovery.
While caring for a newborn.
The
first one, mind you.
Yep. While caring for a newborn. So I ended up with postpartum depression because I was not sleeping. I was having a hard time with medical recovery. So going from being, someone who was lifting weights, working out, to not being able to do any of that, and also just having trouble getting around. And on top of it, I went from working full-time to working part-time. So, and I went from working full-time in a building to working part-time, driving places. So I lost a lot of connections that I was having too. So that was a whole host of just trauma in my life.
Something that you didn't plan for.
Yep.
But again, birth being so intimate, it was something that so deeply impacts you.
Yeah. So that's kind of the start of all of that. So, I know people who have had cesareans. Once again, being high risk is totally different than maybe low risk. But I also know people that have had similar experiences where they were pushed into a cesarean and had a very traumatic experience when it probably shouldn't have gone that way. So my second, I was I do not want this experience again. I do not want the trauma of a cesarean and
recovery.
all the recovery that goes with that. And so I started researching VBACs. And so once again, that's asking your provider. That's another question you can ask a provider. What are your rates of VBACs?
Which for me, I was always led to assume that after you have a cesarean, that's your only option in the future.
Mm-hmm. Yep.
So the fact that I am learning.
Mm-hmm. So some providers will say that. They'll say, no, you can't have a VBAC. Not always true. So statistically, if you're looking at statistics, a lot of times the concern is uterine rupture after having a cesarean, and it's less than 1%. Now, as you have more cesareans, if you were to do a VBAC 2 is what they call it, or a VBAC 3, your increase for uterine rupture would increase with that. But in general, it's less than 1% will have a uterine rupture, which doctors don't tell you that. I remember talking to a friend when I told her I was having a VBAC with my second, and she's like, my doctor told me that my chances were less than 30% and I would probably have issues. And so he didn't recommend it. And I'm like, that's not what the statistics say. That's not what the statistics say. So once again, just going out and doing your own research, asking questions, super important. But so I didn't want that experience with my second. And so some of it was just the people I knew. I had one friend who had 3 home births. She had shared about it on social media, beautiful experiences. She was a huge advocate for it. I had a friend that was local who also had 2 home births. And so being able to ask questions to them, and just the way they talked about birth compared to everyone else I knew was so different. It was positive. It was peaceful sounding. It was, I'm trusting my body. It was, I'm going at my own pace. It was just it was just different. And I was like, I want that. That's what I want. That's how I want to talk about birth. It's just this more positive, peaceful experience.
I was just talking to somebody the other day about this. And I think again, like you said, American medicine, all of our images of birth, not having a child before, or maybe never experiencing a birth, and your first birth is when you're giving birth. All your experiences in your head are the movies and the shows where they're screaming and people are rushing around the hospital room, and the mom is bloody murder, dying, in this massive amount of pain. And that's the way that they paint these pictures of birth for us. And then when we think about it, and like you said, and you hear these people talking about a home birth that's peaceful and quiet and calm and restful and beautiful and positive, you're like, wait, what? I mean, that's not the way that the world tells you birth is. Because I know I've talked to guys before about it, like, oh, have you ever seen a birth or something? And they're like, even Bob, when Rega was born, they're like, oh my gosh, it's going to be so scary and so terrifying. And it's, they're like, oh my gosh, how am I going to handle this? And it doesn't have to be. That's not your only option, to have this horrific screaming bloody murder. You don't have to do that.
Yeah. I think of the Friends episode with Rachel when she's in the hospital and she wasn't progressing. So she's like, why does she get to go back? And, she's about to kill.
Oh my God.
Yep. And some people probably won't get these references,
nope. But we do.
And that's what and that's how they paint birth. And
I think about the Full House episode with Uncle Jesse and Becky, and she's just screaming, and I was like, wow, okay.
Right. And there are women that that's accurate. But I think once again, we tend to paint this picture that it doesn't have to be that way. So with my second, I had started researching into VBAC options, looking into providers, and then knowing friends that had home births. At the time, there was a group that was meeting locally just to answer questions, and they were sharing their experience with home birth. I was like, okay, I'll go to a meeting and see. And I went, and I was just like, okay, this is so cool. Just them sharing statistics or their experiences. There was a mom there who had twins at home. I was like, that's phenomenal. Wow. And just the way that they were talking about it was really fascinating. So then my husband and I interviewed a couple different midwives to at least just try. We're like, let's at least just look into it. And we found a midwife group. They actually it was 2 midwives in the practice. So, which I preferred versus like 1 midwife. So there was 2 midwives. They also had like a medical assistant that came to the birth. So you have 3 people there who are,
so a midwife is a medical professional.
Yeah, that's true. Okay. That's also a stereotype. People think like when you say, oh, I'm having a home birth with midwives, that like you have this untrained woman down the street coming into your home. But that is something you would need to look into too, in terms of like what are their, certifications, where do they go to school, those kinds of things. But a midwife is a medical professional. Many are also like former nurses who have then gone to get their midwife, like
midwifery.
So what is the difference between a midwife and a doula?
That's a great question. So doula, they can have like a degree or not a degree, but like a certification, but they are actually not required. So like you could call yourself a doula.
No, thank you.
You could call yourself a doula and go to a birth with a friend, basically.
Okay, that's really important because I see the term doula a lot more frequently than midwife.
Yes.
Midwives I think they're required past master's degrees to have medical certification in birth. We could find a midwife to interview and ask all those questions.
That'd be really interesting.
The thing, I was also under that assumption when I got pregnant about midwives, and you think like they're going to have, little dream catchers and their hippies coming into your house. And it's like, they know more of what they're doing than a lot of nurses do. They are just very educated, and we love nurses. Please do not take that as a dig to nurses. Love them. Super smart. Great. But
it's just a different setting too.
Yes.
Whereas a nurse has a very specific, there's home care nurses, but I'm talking nurse in a hospital has a very specific role and has very specific instructions that they need to follow. Correct. Whereas midwife, even if they are a former nurse at home, is going to be a very different feeling just because of the setting.
Yes. Yeah. It's different too, even like if you take it out of context, because birth being a hot topic, like you take it out of context and you put it into hospice. There's hospice nurses, and then there's geriatric nurses that take care of elderly. They both do the same thing, but their type of medicine and their way of using medication is very different because of what they do, and that's okay. And we love them both. We love all of them.
Right. Yeah. So a doula, I went with someone who had gone through training, who had a lot of experience with like the number of births they've been at, things like that. So a doula is more for like emotional support. They're going to be someone who is going to run, even if you can have them at the hospital or home. So we actually, with my first, had a doula for the hospital, and it was great because she, even though I had a cesarean, she still like met us at the hospital. She held the baby for a little bit so my husband could put his head down because we were both exhausted after all of that. I was like throwing up because of the like the epidural meds and stuff. So she was like holding the baby. She helped make sure he got something to eat. She stayed with us for like emotional support, as well as just if your husband needs to run to the bathroom or your partner needs to needs to go to the bathroom, and, just someone to be there with you. Your doula is someone that's going to be more like a constant during labor and delivery. Whereas your midwives are literally there for like the medical process. So they're going to be, your midwives are once again medically trained. They're going to be checking your heart rate. They're going to be checking the baby's heart rate. They're going to be checking your blood pressure. They're going to be doing all of the medical things. And my midwives were very hands off for the most part. Like my doula was in the room pretty much constantly, whereas the midwives with my home birth were kind of like, unless there was something going on, they were kind of hands off until I was pushing at the very end. So it's very different. So your doula is, like I said, more like emotional, spiritual support, as well as just those little things like help, applying pressure to your back, or giving, saying to your partner, like, hey, maybe try this, or maybe try this position. Or they're not going to give medical advice, but they're going to do things like that. So with my midwives, so I ended up going with the group of 2 midwives. And they were a great pair because the one was very medical minded and very incredibly knowledgeable and just very science based. And the other was like just a little more like laid back and what's the word, like kind of like comfy, cozy, like she was just that, she kind of gave you that feeling. So they were a really great pair because they both were incredibly knowledgeable, but both had really like different styles and personalities. And I was telling Mandy this. So when I went with this group in my first prenatal appointment, this is when I knew it was going to be totally different. My first appointment, she's going through my history from my first birth. We're talking through things, and she checked my blood sugar and stuff, and she's like, you have blood sugar issues, which is probably why I didn't sleep. I struggled with sleep like crazy, and they were just like, oh, that's normal. Okay, nope, not normal. Literally changed my diet during my second pregnancy. Just did things more protein, just changed my diet to be a little bit different. Slept way better.
Wow.
It was crazy. She pinpointed that in my first appointment, just from my history from my first pregnancy. And then the other thing she figured out was I probably had like pelvic floor issues, which is why he was also breech, which is once again where I'm like, she was like, you need to do chiropractor, and I'm going to refer you to a pelvic floor specialist, basically like a PT, physical therapy. That made all the difference. Like I did not have back pain like I did with my first. He ended up, head down, because I had a lot of back issues with my first pregnancy as well. Didn't have nearly that with my second because we were working on making sure things were in alignment. So it was just crazy things like that she knew just from my history in the first appointment. So the knowledge of some midwives out there, they know the body, they trust that your body knows what it needs to do. And it's just different. I don't know. It's just different, I feel like, than a doctor. So, and I'm not trying to dig on doctors. It was just a totally different experience for me working with midwives who basically just have this crazy knowledge of the body and what it's supposed to do during birth.
Well, it just sounds like it was so vastly different than the first experience where you were told what type of birth you were going to have.
Yeah.
Based on that provider. And so just that seems like it really colors a lot of, you got to make a lot more choices this time around. And that was probably really empowering.
Yep. Yeah. So, like all my prenatal appointments were great. I mean, they would do your normal things like you would at an OB office, like check the heart rate and your blood pressure and, medical stuff, they would ask questions. But there was more time. Like I felt like I got a more intimate experience, or they asked questions that were not asked with my first, but it helped. It was things like tweaking my nutrition. It was more like, it felt more like well-rounded wellness to have the birth that you wanted in a healthy pregnancy versus just this like cookie cutter, you have
to fit in this box. Hey friends, that's the end of our part 1 with Allyson. So tune in. Very shortly, we'll be releasing part 2. Check that out to hear the rest of our conversation. We hope that you're enjoying this awesome discussion and just time together. So check out part 2.